With close to half of Los Angeles County adults now with at least one dose of coronavirus vaccine in their arms, health officials have become more confident the county will succeed in vaccinating enough people to prevent another massive surge in cases possibly taking place again like it did this winter. But while the county has made great strides so far in vaccinating workers and residents, there is a recognition that getting the second half of adults inoculated will not be as easy because they represent people who may well be more hesitant. The county has already vaccinated those who were most eager for a vaccine, with more than 75% of residents 65 and older now with at least one dose. Some people are taking the current slope of vaccines being administered and making projections, just extrapolating out that curve, said Robert Kim-Farley, Ph.D., professor of medical epidemiology and infectious diseases at the UCLA Fielding School of Public Health. But I believe we are going to see the tapering off of that curve, not because of vaccine scarcity but because we have reached those who are willing and able to take it. As more people get vaccinated, Kim-Farley said he's optimistic the rates of those who are hesitant or refuse to take the vaccine will decrease. A recent survey by the Public Policy Institute of California put the number of residents in the state hesitant about the vaccine at roughly 20%, while a Census Bureau poll in April had California at around 10% vaccine hesitancy, among the county's lowest. We can't be complacent about average levels of immunity in the community, Kim-Farley said. They can hide pockets of low levels of immunity. If you have pockets of people who are vaccine hesitant, COVID will find those pockets and you'll have small outbreaks, like brushfires going on in different areas. Even as vaccine eligibility expanded on April 15 to everyone 16 and older, appointments for doses this week in LA County were not being scooped up as swiftly as they were previously. Appointments were still getting picked up, but no longer were slots getting booked in less than an hour. 2 sites in Antelope Valley received extra doses, so officials responded by making vaccines available without appointments. Some other sites were welcoming walk-ins, too. Chief Science Officer Dr. Paul Simon said Friday that he wasn't expecting such a slowdown just a week after what officials thought would be a tidal wave of vaccine seekers. "I was expecting a bigger surge here after the expansion on April 15, Simon said. A couple things may be playing into this. Our case numbers and hospitalizations are so down that it may be that some people are feeling a sense of complacency or a sense that the vaccine is not all that important." Addressing those people, Simon said that getting a vaccine was as much about protecting the community as it was for the individual.